Welcome to Toronto Children's Services' most recent update module. Toronto Public Health made some changes to their guidance document in February. This module provides a quick update on those changes. This module does not replace the existing module. The full training module must be viewed in order to meet the mandatory training requirements. There are some significant changes to the screening process. We will begin with the child screening and exclusion. Children will be excluded if anyone in the household has one or more symptoms. This was previously based on other children in the household having a symptom. Children will be excluded if anyone in the household has travelled outside of Canada in the past 14 days. This was previously only if the child had travelled outside of Canada in the past 14 days. Children will be excluded if anyone in the household has been notified as being a close contact of someone with COVID-19 and been told to self-isolate. Previously, only children would isolate if they had been notified as being a close contact. Ensure to refer to the updated screening posters and make them available in your designated screening areas. Moving on to the staff and visitor screening and exclusion. Staff and visitors will be excluded if anyone in the household has one or more symptoms. Staff and visitors will be excluded if anyone in the household has travelled outside of Canada in the past 14 days. This was previously only if the staff or visitor had travelled outside of Canada in the past 14 days. Ensure all program staff are aware of the changes. Toronto Public Health have developed decision guides that assist programs to determine the processes that must be followed if an individual has symptoms, travelled outside of Canada, or has been identified as a close contact. It is important to refer to the decision guides to ensure you are consistent with your processes and updating your COVID-19 policies and procedures. This slide speaks to cohorts identified as close contact of someone with COVID-19. Childcare staff, students, and children exposed to a confirmed case of COVID-19 must be excluded from the childcare setting for 14 days from the day of their last exposure. This includes the cohort and anyone who has come into contact with the individual with the confirmed case of COVID-19. For example, a staff who works in the room to cover lunch breaks. The childcare operator should dismiss the cohort for self-isolation while awaiting the results of the Toronto Public Health investigation. These individuals must self-isolate at home and monitor for symptoms for the next 14 days. Individuals who have been exposed to a confirmed case of COVID-19 should get tested. If the test is negative, the individuals will need to continue to self-isolate for 14 days and continue to monitor for symptoms. Refer to Toronto Public Health's decision guide for dismissing cohorts or contact Toronto Public Health at their COVID-19 hotline by email at publichealth@toronto.ca or by calling 416-338-7600. There is a new age requirement for mask use. Children in grade 1 and above are required to wear a non-medical mask or face covering while indoors at the childcare setting or in hallways. Children in junior and senior kindergarten are encouraged to wear a non-medical mask or face covering while indoors at the childcare setting, including hallways. Masking is required outdoors where physical distancing cannot be maintained. That concludes this Updates module. Please inform your supervisor or director that you have completed this training module. We have provided a list of additional resources for you to access. They can be found on the website along with this video.